what happens with gum disease?
Mm,
Why do we have to worry about gum disease?
gum disease. So there's this little tiny little when you have healthy teeth, you have
Mhm.
tiny bit of the flap around the tooth where the gums are not attached to the root yet. So bacteria and particles of food get stuck in that little flap. If you don't remove it regularly, then this bacteria is going to eat that food, release acid. This acid is going to dissolve the connection between the gums and the tooth. And this flap is going to get deeper and deeper and deeper and deeper and deeper. And we, at that point, call it a pocket. Like you can put something in there. You can put more food and more bacteria can get stuck in there.
Right.
And then the process keeps on going. And this bacteria keeps on eating food, releasing acid. This acid damages the gums. And when the gums are damaged, the bone runs away. There is a pathway for your body to dissolve the bone where it needs to be dissolved. There's special cells for that within the bone because the bone doesn't want to get infected. It really wants to run away from any danger. And bacteria is always dangerous to the bone and to the gum. So when the bone senses, when there is a signal, chemical signal that is sent from the gums into the bone's going to run away, run away, run away. And then you end up with what they call long teeth. Have you ever heard that?
No, I've
No.
never heard that.
Okay. Basically, the tooth gets more exposed and it looks like it's erupting from the gums, but it's not really the case. It's just the gums shrink down and more of the root is being exposed. And at some point, teeth become wiggly, loose. And if you wait long enough, they're going to come out and there's going to be pus around the gums and there's going to be pus in the bone. And this is an amazing way to lose your teeth without cavities. Gum disease is silent, it doesn't hurt, and it is notorious for people to lose teeth. Notorious. Once a week, I see someone in my chair to whom I have to say, listen, I cannot save this, not because there's something wrong with the tooth, but because the gums are gone and the bone is gone and there's no support. It's like, the carrot in the tooth is kind of like a carrot in the dirt, and you start digging the dirt out from around the carrot, and eventually the carrot's just going to be all exposed and so much easier to take it out. And we chew on teeth, so teeth become mobile and people lose teeth because of the gum disease. We'll call it periodontitis, periodontal disease. So easy to prevent, such an easy thing to prevent. If you have bad breath, if you see when you floss, gums bleed, if you see that when you use the toothbrush and there is pink toothpaste, this is the signs for you to come to a dentist because you 100% have gum problems. Like there's no pink toothpaste without gum problems. There is either gingivitis or periodontitis already going on.